subcutaneous injection of insulin using an insulin pen. So before I enter the patient's room, I'm going to check to see the scene is safe. I'm going to provide privacy and dignity by closing any doors and curtains, and I'll be doing my hand hygiene according to WHO standards using my validated hand gel. And allow to dry for 30 seconds, assuming 30 seconds is done. Good morning. Hello, my name's Wendy and I'm from the community nursing team. I've come to do your subcutaneous injection of insulin for you. Is that okay? Are you expecting me?
Yes, I was.
Lovely, okay. So before we start, just need to go through your details as you know and check you have any allergies. So can you please just tell me your first name?
Jack Street.
What is your home address?
Hope Street.
Okay, and that's RH115R, yes?
That's correct.
Lovely. And your date of birth, please?
15th of January, 1952.
Okay, so here I've got Jack Street, Hope Street, RH115R, and date of birth 15/01/1952. Jack, do you have any allergies at all?
No.
No, okay. And we also have that clearly documented. So as I said, I'm here to do your insulin. I'm just going to check the prescription with you, okay? So you're to receive insulin glargine, 14 units, and that is via subcutaneous route. And that means it's going to go into the fatty tissue just underneath your skin. It's due today at 0800 hours, that's my time. And the prescriber's signature is there and valid for today. So this is a valid and legible prescription. So I'm happy to give you this today. So as you may know, Jack, insulin glargine is a long-acting insulin, which means that you're unlikely to have hypo episodes, but as long as you eat regularly. So can I just check, firstly, have you done your blood sugar this morning?
Yes, I have.
Was it okay?
Yes, it was.
Lovely. And do you have meals prepared throughout the day?
Yes.
Lovely. And if you do have a hypo, you know that you should take something sugary immediately, yeah?
Yes.
Okay, lovely. All right, so where did you have your injection yesterday?
I think it was on the left.
On the left
my
side.
tummy.
And you're aware that it's important to rotate the injection site daily so that we don't have any tissue damage. Okay? All right, so you did it on this side of your tummy. Where would you like it today? You can have it in another part of your tummy area, in your thighs, or the back of the arms. Where would you like it?
Can we do on the right side of my tummy?
We can indeed. All right, that's fine. All right, I'll just go and get my equipment and I'll be back with you in just a second.
Okay.
All right, lovely. Okay, do my hand hygiene. Okay, so I've got the patient's insulin pen here. This is insulin glargine and it is for single patient use. It's 100 units in 100 mils and the expiry date is 03/2026. So this is clean and it appears intact and it's safe to use. I've got my BD Auto pen, which is specially designed for this patient's pen. And this is clean, dry and intact and it expires 08/2027. So that's safe for me to use. Okay, I'm just going to get my PPE. Putting it on with the cleanest part facing the patient. And I'm going to take my already validated gloves and my hand gel back to the patient. Okay, so Jack, is it okay if I minimally expose you just to check this site?
Okay.
Okay. So I'm just going to check the site. There's no signs of infection, inflammation, edema or any lesions. So I'm happy that that's a good site to use. Also, I'm checking to see the site is visibly clean. It is clean, so I won't be needing to clean the area, but if it wasn't clean, I would use an alcohol swab for 30 seconds and let it dry for 30 seconds prior to administering the drug. Okay, so I've touched my patient, so I'll just do another quick hand hygiene. And I'm going to now assemble my equipment. Okay, so take the lid off the pen. I'm just checking that the insulin is in there and the expiry date has already been checked. I'm going to screw the needle onto the pen, taking care not to over tighten, and I'm going to hold it upright while I prime to 2 units. And I just need to press the bottom until I see some insulin coming out the top. I see a little bead of insulin coming out the top, so that's my needle primed. And I now take it back to 0. Just check how many units that the patient is due. 14 units, so I'm going to turn the dial till I get to 14 units. So I can confirm that I have 14 units. Okay, so are you ready, Jack?
Yes.
My patient has plenty of subcutaneous fat, so I don't need to pinch. I'm just going to stabilise the area and go in at 90 degrees. And press the top of the insulin pen until it won't depress anymore. Holding it in the skin for 10 seconds. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Swiftly withdraw. There's no bleeding. Jack, if there was bleeding, I would offer you some gauze, but there's no bleeding today, so I'm just going to remove my needle, and that will go into the sharps bin. I can then store this according to my patient's preference. It doesn't need to go into the fridge because it's already been opened. Everything else would go into the domestic waste. My PPE goes into the clinical waste bin. Do another hand hygiene. Come back and do my documentation. Print, sign, date, and the time. Okay. So that's me all done for today, Jack. Thank you very much. Someone from the team will see you again tomorrow. We'll leave you with a leaflet which explains what to do in the case of a hypo, and you know that if your sugar trick isn't working and you still feel really unwell, you should call 999 as it's a medical emergency. Okay. All right. On that leaflet, there's also our contact numbers. So if you have any questions, we can answer them for you. And someone will see you again tomorrow.
Thank you.
Okay.